In the world of cardiology, a simple indicate specific heart conditions. For example, a missing P wave might indicate atrial fibrillation, a common type of irregular heartbeat. A widened QRS complex could suggest a block in the electrical conduction. Segment elevation, PR segment depression, and upright T waves. As the condition progresses, the ST segment may become isoelectric with flat or inverted T waves. Certain drugs can also affect ECG readings. For instance, therapeutic levels of digitalis can cause ST downsloping, T wave depression, QT shortening, and slowing of the ventricular rate in AFib. Toxic levels, however, can lead to arrhythmias and regularization of ventricular rate in AFib due to a junctional rhythm and AV dissociation. Other medications like amiodarone, quinidine, phenothiazines, and some antihistamines and antibiotics can result in a prolonged QT interval and U waves. Knowing how to spot these ECG changes can help you diagnose heart diseases accurately and promptly. Today, we've delved into the essential skill of reading an ECG, a crucial tool in diagnosing heart diseases. We've unfolded the step-by-step process of interpreting an ECG, starting from understanding the basics to identifying common changes associated with heart diseases. We've explored how electrolyte disturbances, hypothermia, pericarditis, drug effects, and pulmonary disorders can impact the patterns on an ECG. Remember, these skills are sharpened with practice and dedication. With practice and dedication, you too can become adept at reading ECGs, a vital skill in the medical field.